Thank you, Mana. Hello and welcome everyone to Infoway's Benefit Evaluation Collaboration Network webinar. I hope you are all staying healthy. My name is Nancy Gupta and I am part of the performance analytics team here at Canada Health Infoway. I thank you all who have taken the time to join today's webinar. For anyone new joining today, welcome, and we hope you will continue to be interested in our future webinars. The goal of Infoway's Benefit Evaluation Network is to connect digital health leaders, evaluators, and researchers to share best practices, results, and other insights focused on evaluation in digital health. We have regular webinar series such as this one to share new evaluation insights. You can visit our website through the link you see on the screen to stay up to date. The slides from today's webinar will also be posted there as well. Our membership is continue to expand and grow, and we invite you to join us or share information about this network with anyone who may be interested. You can get in touch with us through email on the screen. So today I will share the findings from Infoway's Canadian Digital Health Survey about Canadians' use of and satisfaction with e-mental health tools, as well as summary of survey findings from Kids Health Phone's texting service. We will hear from my colleague Bhuvan. His preferred name is Barry. Barry is taking his master's degree at University of Toronto, majoring in data sciences and machine learning areas. Barry will provide us an overview of Infoway Insights website, a new way of sharing the results of the recently completed Canadian Digital Health Survey. It's an easy-to-use self-serve data visualization tool intended for a variety of audiences and contribute to Infoway's effort to be the go-to source for credible evidence about digital health in Canada. We will be joined by Michelle Laplante, policy and planning consultant with Nova Scotia Health's Mental Health and Addiction Program. She coordinates the Mental Health and Addiction helpnovascotia.ca website, as well as working on the implementation and monitoring for e-mental health tools and virtual care resources, among other projects. She has been working with Nova Scotia Health for over 6 years and joined the policy and planning team in early 2020. Michelle will discuss the launch of the website, its success in supporting the mental health of citizens in Nova Scotia. I would like to extend special thanks to Krista Valenko, Senior Director, Program Delivery Virtual Care Programs. She will provide an overview of Infoway's contribution in mental health space. I also like to thank you, Agnes Palantine, who really supported us in organizing this webinar, and Simon Higgins, Senior Director, Performance Analytics. Simon will facilitate the discussion and Q&A at the end. And also a special thanks to Performance Analytics team. So consistent with the typical format, we will hear from the presenters first and hold questions at the end during Q&A session. All your lines have been muted, but I encourage you to use Q&A function to pose your questions as they come up throughout the webinar. Simon will post them on your behalf to the panelists at the end during Q&A period. We would also like to make you aware that we have closed captioning services available for the meeting. To access it in English and in Zoom, you can click the arrow next to the closed captioning at the bottom of your Zoom screen and select Show Subtitles. You can also follow the link that has just been dropped in the chat box. Now I would request Krista to provide an overview. Krista.
Hi, Nancy, it's Agnes. I just got a text from Krista that her internet just went down.
Agnes, I'm on.
Okay,
Agnes,
perfect.
Can you hear me?
Yeah, I can. She's back.
Sorry about that. Internet connections are always right on point when they drop. So over the past number of years, Infoway has been gathering perspectives, priorities, and strategies for e-mental health and addictions across the country. We've made investments in Kids Health Phone and worked closely with the Canadian Mental Health Association and Centre for Addiction and Mental Health on a number of national projects, such as texting services, virtual recovery college courses, and online resources. We also had focused investment in the Atlantic region, of which you'll be hearing from Nova Scotia today. Their work leveraged the experience of Newfoundland and Labrador government, which had developed a suite of e-mental health services back in 2015 called Bridge the Gap. They have an innovative online mental health promotion resource for youth and adults to support mental wellness. More than 90,000 people have used the service in 2020, and that's double the number from the year before. Over the last year, Newfoundland and Labrador worked closely with colleagues in Prince Edward Island and New Brunswick to develop localized and bilingual versions of Bridge the Gap website for each of their provinces. This is known as Naviga en français. Since launching in late December, these websites have been used by about 1,000 people in each province every week, and citizens just love these online tools. With that said, I'll turn it over to Nancy, who will be sharing the results of Canadians' use and satisfaction with these kinds of mental health tools. Over to you, Nancy.
Thank you, Krista. So we know that COVID-19 pandemic has significantly impacted all the aspects of our lives, including physical health, mental health, social health, and financially as well. It has deepened the mental health issues in Canada. And some of the reasons are social isolation, job and income loss, and difficulties meeting financial obligations, which has really impacted the mental health and well-being of Canadians. Resources and support have been made available by Canadian government, including Wellness Together Canada. However, long-term integrated plan is required to combat mental health issues in Canada. So I'll discuss findings related to mental health need, use of, and satisfaction with e-mental health among Canadians. These are the findings from Canadian Digital Health Survey conducted by Infoway. The survey was in field mid to end of August last year and provide valuable insights about people's use and experience with digital health platforms. Here is a summary of the findings. From the survey, we found that fewer people reported excellent or very good mental health. Mental health concerns impacted certain demographics group disproportionately. We'll also discuss in detail about how people have been accessing e-mental health and their interest in accessing mental health support. So from the survey, we found that fewer people reported excellent or very good mental health status in 2020 compared to in 2019. Similar findings were illustrated by Canadian Perspective Survey Series, which was conducted by Statistics Canada. We also saw that mental health concerns impacted certain demographics group disproportionately. Although men and women both reported worse mental health status in 2020 compared to in 2019. However, women were less likely to report excellent or very good mental health compared to men. We also saw that youngest age group were least likely to report excellent or very good mental health, and they were also likely to report poor mental health in 2019. And we also did survey in 2019, and we found the same findings. Again, if we compare all the age groups, we saw that adults in all the age groups were less likely to report excellent or very good mental health in 2020 compared to in 2019. For the sex and gender-based analysis, we utilized and we took the same categories used by Statistics Canada. For this analysis, we found that some gender differences in perceived mental health condition before and during the pandemic. For example, young men less than 25 years of age and adults 25 and more are more likely to report excellent or very good mental health compared to young women less than 25 years of age and adult women 25 and above. With the pandemic, mental health conditions seems to have deteriorated for all the gender categories under observation, but overall, the gender gaps in perceived mental health condition have not changed substantially. We looked at the perceived mental health in various ethnic groups and compared 4 groups. Indigenous group was least likely to report excellent or very good mental health and are more likely to report fair or poor mental health compared to other ethnic groups. Statistics Canada collected crowdsourcing data in June last year, and the results shown that 60% of Indigenous reported that their mental health has become somewhat worse or much worse since pandemic. Differences were seen in perceived mental health of people based upon their annual income as well. Those with an annual income less than 25,000 were least likely to report excellent or very good mental health. We also saw that people living in small population center or rural areas were more likely to report excellent or very good mental health. However, more evaluation or research is needed to understand this phenomenon. We saw that people living in Quebec were most likely to rank their mental health as excellent or very good. We see that similar findings were also illustrated by a survey conducted by Leger and Association for Canadian Studies last year. Similarly, Francophones were more likely to report excellent or very good mental health compared to people who speak English and those who speak languages other than English and French. So besides self-reported and self-perceived mental health, 17% of survey respondents had a mental illness diagnosed by a physician, and majority of them were females. We also saw that 33% of those with a diagnosed mental health have accessed e-mental health, and 60% of those with a diagnosed mental health who have not accessed e-mental health would like to do so. Similarly, 32% of those with a drug or alcohol dependence have accessed e-mental health, but 57% of those who have not would like to do so. We saw that Canadians are starting to have access in mental health support in greater numbers. 16% of Canadians reported that they had used e-mental health tools in the past years, up from 12% in 2019. We see that 52% reported that they would like to access e-mental health tools. So these patterns in mental health status seen across different demographic groups, that younger Canadians and women are most likely to have accessed e-mental health tools and express interest in accessing them in future. Although we do not see much difference, however, those with a regular place of care are more likely to report excellent or very good mental health compared to those who do not have a regular place of care and are slightly less interested in accessing e-mental health. We also saw that those who reported their mental health to be fair or poor are more likely to have accessed e-mental support and are interested in accessing e-mental health compared to those with excellent or very good mental health. So of those who have accessed e-mental health support, a majority of them used government websites, related associations, or employee assistance programs. However, of those who used services during COVID-19, majority of them, 53%, used Bridge the Gap. Sorry. So here is a list of various e-mental health tools available nationally and in different jurisdictions. However, it is not an exhaustive list. So Canadians who used e-mental health tools services tend to be quite satisfied with their experience. For example, 83% reported that they were satisfied with the care, and 81% reported accessing care more quickly. Also, 78% of the survey respondents reported that they have avoided at least one in-person visit to primary care physician or emergency department. When we asked survey respondents about their satisfaction with the specific platform they have used, users of Bridge the Gap were most likely to report satisfaction. Now, I will present some findings from the survey from Kids Cell Phone texting services. The purpose of this analysis is to provide the summary of the findings from the Kids Cell Phone texting services from January 2020 to August 2020. We know that hospitals use for children and youth with mental health disorders have increased significantly over time. But Kids Cell Phone provides equitable access to professional counseling, support, information, and referrals for young person in Canada in the way they need the most. From January to August 2020, Kids Cell Phone had almost 50,000 unique users and over 100,000 conversations with youngsters. Almost all survey respondents agreed that the service was easy to use. 4/5 said that they were satisfied with the services, and over half agreed that they are now more confident to cope with the situation. Also, Kids Cell Phone helped 5% of the respondents to avoid emergency visit and 4% of the respondents to avoid a primary care visit. From the survey, we saw that 3 out of 4 Kids Cell Phone survey respondents were below the age of 24, and majority of them were females. When we asked what would you have done if the services were not available, majority of the respondents said they would have ignored the issue, and also 5% of the respondents would have gone to emergency room visit, and 4% of the respondents said they would have gone to primary care provider. However, it would have increased the health system cost as well. These are some of the references I have used specifically for kids' cell phone analysis. Thank you so much. And so now Barry will provide the overview of the Infoway Insights, the website which we have developed for the easy visualization of the data. Also want to mention that we have recently updated the data words with the Canadian Digital Health Survey and recent surveys on Canadian attitudes around consent. Over to Barry.
Perfect. Thank you, Nancy, for the amazing introduction to the Infoway websites. So let me share my screen now. Can you see my screen? I believe so. Okay. Yeah. Okay. So I will do a quick demo with the Infoway Insights website we just developed recently. So as Nancy mentioned, this website is focused on the annual tracking survey we conduct every year. So this is a homepage of the website. As you can see, we have divided the survey questions into different categories. And as you can see, let's go to the About page. So this page basically gives you some methodology after the survey and also the website. And also Nancy mentioned the Dataverse. We collect the data into our Dataverse. As you can see, you can click on the link and jump into the data source. As you can see, the annual tracking survey result is here. Okay, let's go back to the website. Let me do a quick introduction to the dashboard. So today's topic is about the e-mental health. And you go to the survey topics and you go to the e-mental health dashboard. You can see all the visualizations we created for this page. And I think you have seen this graph before, as Nancy mentioned. Okay. And the most important functionality of this website is to apply some filters. For example, for some jurisdictional partners, they may interest into different provinces, and you can simply click on, for example, in this case, Alberta, and you can see the graph will be automatically changed to the Alberta's data, and you can maybe do a screenshot of the data visualizations and put in the report. And another thing worth to mention is that you can click on the data tables and go to the 2020 data. This page gives you all the original data set you can download directly from this website, and you can download for each question, or you can download the full question set from this website. Okay, so if you want to dig more into this website, I will share the link into this chat box, and welcome to dig into it. I think that's it. I will hand over to Michelle to give us the rest of the discussion. Thanks.
So hi everyone, we're just getting to there it is. The Nova Scotia part of the presentation. So my name is Michelle Laplante, and I'm a consultant with the policy and planning team here at Nova Scotia Health Mental Health and Addictions Program. And I'm going to talk to you today just a little bit about our new website. So continuous improvement for a people-centered website. Bit of a mouthful of a title. So just to tell you a little bit about, so for the website, we've taken a phased approach, which started with, of course, launching the website. The URL is there, and I just wanted to take a second as well to thank our funders. So Canada Health Infoway, of course, was instrumental in setting up the website, and then the QE2 Foundation is just one of our hospital foundations here in Nova Scotia that helped fund some of the tools, some of the e-mental health tools that we have on there. And the reason I'm talking about the website today and not about the tools specifically is that we really do see the website as sort of a service in itself, and as a way to access those tools, because without a good functional website that people are accessing and comfortable using, the tools wouldn't be much good anyway. So if you want to just move to the next slide, one thing to mention is that we did really want to pay attention to co-designing the website. And so that involves sort of some of the things you see on the screen there, public forums, focus groups with different groups. We've had opportunities for feedback through surveys, and Design Day was another sort of focus group with some of our key informants once the website was launched, to help us sort of see how it was going and where we could move from here. So again, that first phase of the website was to put it up, and that was back in June of last year, sort of peak COVID time. And getting that sort of up and running was really important. But once it's up, then we get to live it with a little bit and get to see kind of what's going well and what we need to improve. And so we really did want to make that a process that involved kind of as many people as we could, because this is really for the public, and part of its role in kind of increasing health literacy, mental health literacy as well, and having that accessibility and that a little bit of stigma reduction as well, just in the awareness building with the website. So if you move to the next slide, I believe we just have a quick video to show you. So this is just kind of our website promo video. It's just a sort of 1 or 2 minutes just to show you kind of what it looks like and how it works.
Nova Scotians who have concerns or questions about mental health or addiction for either themselves or a loved one have a simple, friendly, helpful place to turn. Welcome to mhahelpns.ca. Here, visitors will find a warmly designed and easy-to-use website that makes it simple to find information, tools, resources, and even emergency help. The heart of the website is an intelligent wizard tool that guides visitors on a personalized journey tailored to them. The visitor simply answers a short series of relevant questions, none of which are personally identifiable. Based on their answers, the site directs them to resources, tools, information, and programs that align with the visitor's unique needs. The site empowers Nova Scotians to educate themselves by presenting easy-to-understand information on conditions, symptoms, substances, and more. It offers free access to evidence-based online programs available 24 hours a day, 7 days a week. And it provides accurate, up-to-date information about support options in their community. This important and informative website reminds Nova Scotians that they are not alone. Hope and help are always at their fingertips.
So that's our kind of quick promo video, just to show kind of what the site offers and how it works. That we have that available for folks to share, some of our community partners as well, just to know, so that that's a resource that they can share with their clients and their patients and their partners. I just wanted to touch on as well this sort of diversity and inclusion piece, because it's something that is important for us to bake into everything that we do. You know, with, not that we're perfect by any means, but it's something that we've turned our attention to, and that is important for us to kind of move forward with. And so I just named there sort of some of the things that we have been doing and that we do you think are important about this website? And so some of the things there related to offering different kinds of options. And that's, again, something that eMental Health tools are there to support, that sort of offering a variety of options that suit people's different needs. The pieces about accessibility, having things that are available 24/7, including the website itself, where people can access information and tools and resources. Making sure we have sort of good representation in our images and videos, and having those sort of printable, as well as sort of that co-design piece that I mentioned earlier. Also to note, the website is available in French in its entirety, and we're also working with the Mi'kmaq people here, on whose land I am now, in working on not just doing a straight translation one-to-one, but to actually work with folks to see, what are the pieces that are important to translate, but also what other resources should we be linking to, what other, how we can design things better to be more sort of culturally competent and more useful for a broader variety of people. So if you want to just move to the next slide, just talking about evidence. So I haven't packed this presentation too full of sort of the numbers themselves, but just to give you an idea of some of the things that we are tracking this year. I won't name them all, but just a number of sort of things that we are tracking, that we have tracked in the past year and this year, related to sort of the analytics of the website traffic itself, as well as the tools, the social media impact, so our posts on Facebook and Instagram, including paid ads and sort of natural reach, the different presentations that we've done with different community groups and partners and providers and public, the different sort of communications and promotions pieces that we're working on, videos, promotional materials, that kind of thing. We have specific reports from different pieces of the work related to this, as well as those critical feedback opportunities to hear from people in those sort of qualitative ways, making sure we're doing that engagement and gathering people's feedback that way. But so those are kind of the pieces of what kinds of data we're getting, what kinds of information we're getting, but more importantly, how we're using that. So part of it is being able to use that evidence as we go to drive changes and be nimble and be informed by that data and feedback as we're making changes. But also, as this is sort of new for us, it's also learning and working together to see what kinds of key performance indicators, what kinds of data are the ones that we should be gathering, how to make that sustainable, and making sure we're not just bean counting, we're not just counting everything we can count, but it's about seeing which pieces of information are useful and how we can use those in the future. So I just wanted to flash up just a couple of things here just to talk about. So in terms of our website traffic, and this information is a little bit old now. I think it's from about a month or so ago. We're actually hitting that 350,000 projection by the end of the fiscal year, which is in a few days. So just to show kind of the impact that it's had to design this new website that is more people-centered and sort of bringing awareness to it. This year in particular, that's been a difficult year for a lot of people. So that, just for perspective, I think is about 12 times higher traffic than in fiscal 2019. And I'm showing this in part, not just to brag, but in part to say, we are gathering this data, but it only tells a part of the story, right? It's not knowing that there's higher traffic doesn't necessarily get at why there's higher traffic. So we know that's been a hard year. We've been doing some promotion. You see some of our social media campaign. Our last campaign last year reached approximately 21% of all Nova Scotians. So there's different factors that sort of could have led to this increase. So there's those pieces about the why, but there's also kind of what are we doing with this? So with that knowledge that we're reaching a lot more people than we were before, there's that responsibility that comes with it as well, and knowing that that's an access point for a lot of people, and gives us an opportunity to drive people to those e-mental health tools and those sort of self-directed resources and information, maybe before they sort of enter a more formal, the formal mental health system, or during or after as well. It means that, you know, any views, even if it's someone who's not sort of in need of services or formal services, it's still serving that purpose of kind of introducing topics to people, helping with mental health literacy, building that awareness, and sort of working towards that, lowering the stigma. And then, you know, but this is just kind of how many page views just as a measure, but we're also, beneath that, we're also looking at sort of what are the demographics and how many people are spending time on which pages and for how long. And that helps us sort of hone in on what we should be doing and how we can be doing it better. So just to talk about, so that's sort of a snapshot of the last year and how we got to where we are now. And again, this phased approach, we wanted to get it up, get as much information as we could in front of people in as short a timeline as sort of could make sense. And then now our work is to take that information, take that feedback and that data, to keep improving, and to keep sort of driving people to those resources and making them better and more useful. So we're kind of looking at it in a couple of different buckets. So the first one is building awareness, because people aren't aware of the website, they're not going to use it, right? So I just put up kind of a sampling of some of our promotional products, our posters and contact cards, and one of our digital ads there. These are, again, the ones, so we had a promotional campaign last year, and then we had some learnings from that, and now we're building on it to do more this year. We also have hired an e-mental health and addictions community coordinator. Her email is there in case anyone's sort of interested in learning more, or if anyone's joining us from Nova Scotia and wants some more information on e-mental health tools. Her role is really to go out and reach out to our community partners, and to our staff and to the public to, you know, to build that awareness, to give sort of mini sessions on where people can access it and what it is, and build that sort of trust as well in the tools and how to use them. And I've stuck up our Facebook page there as well if anyone wants to follow along and see what we're up to, follow our posts. The next piece is delivering services as the next sort of bigger bucket. So that's the actual, you know, again, the website as a service in itself. We want to make those improvements. So we're, you know, based on some of the feedback and the data that we've gotten, there are improvements that we're making to the website, to the functionality itself, and then as well to sort of adding to it now, adding additional tools and resources as we learn sort of where the needs are and where the gaps are. Then the next piece, again, a critical piece, is that strengthening connections. So I've just thrown up some examples there of some of the projects that we're working on with our partners in the community and in government. to really, the mental health landscape isn't a monolith. It isn't just us, working alone. We have many partners in the community that are working on, that touch on different pieces of it. And so we have, for example, a digital equity report that we're working on with the name is small there, but the National Collaborating Center for Determinants of Health. We're working with them on doing that sort of environmental scan. We're working with the Nova Scotia Native Women's Association on those sort of recommendations for how to better support the Mi'kmaq people and Indigenous folks around here. And then a number of we're working with Réseau Santé on some of our French promotion. And we're doing an e-mental or youth surveys as well. And anyway, just a sampling there to show that really working together and sharing information and sharing feedback is critical to how we're moving forward. And that's kind of the end of that presentation. So I'm just taking a moment to thank all of the partners and supporters that have worked with us on this and continue to work with us. And in particular as well, those first voiced advocates and family advisors who have helped us along the way. And with that, I'll pass it back over.
Wonderful. Thanks very much, Michelle and Nancy and Barry and Krista. Great comments and some really interesting topics. So we're now going to have a Q&A session, and I would encourage everyone to enter any questions you have in the QA box. There have also been a couple of things in the chat, so we'll get to those. And I will dive right in. So there's a couple that are around some of the logistics, which I might just answer off the top. So one question was around the survey timing of the evidence that was presented by Nancy. So that survey, our annual tracking survey, was in field in August of 2020, and I anticipate that this year, 2021, we'll be back in field again sometime in the summer with a similar follow-up. So there'll be essentially year-over-year trending for many of those data points. We also had a question about whether there would be a copy of the report available. A couple of things to note. Up on the website, the Infoway website right now, there's an overall report from our 2020 annual tracking survey, and we can share a link to that. The Insights website that Barry shared has all of the raw data that Nancy shared in her presentation, but I believe we'll also post those slides as well. Nancy, I don't know if you wanted to comment on that.
Yes, definitely. The slide will be posted on this link. You can see on this particular slide. All the slides will be posted over there, and you will be notified once they have been posted.
Great, wonderful. So yeah, so lots of ways to access the information, and by all means, feel free to reach out to us if you need help getting that evidence. So a couple of questions around the content. We've got a question around there. So in Nancy's content, she shared sort of a bit about the overall interest of Canadians to be able to access e-mental health tools, and then a little bit about the actual use of those tools, which is much lower than those that have interest. So we know that there's a variety of tools out there. So this is a question really for any of the panelists to weigh in on about what creates that gap. Are we talking about an awareness issue? Are the tools not exactly right for people's needs, or how do we sort of bridge that gap between the availability of those tools and the actual use? So I'm wondering, I don't know, Nancy, if you want to jump in with any comments on that, and then I can go to the panelists as well.
Definitely, Simon. We have been collecting, we have been looking at the data collected by other organizations as well, what's going on. In terms of the awareness, definitely there is a gap in terms of people knowing what to do if they have mental health issue. Do they know if they have mental health issue, and where to look for the resources? And we also say that there are tons of resources, tools available, but they might not know what is the best resource for them for their particular mental health condition. is there evidence available for each mental health tools or source? What's the best for them? So these are the gaps we have seen. People are responding, and definitely there is a need to improve the awareness, telling people, if they have mental health issue, where they can look for the resources, what are the best resources available to them. So these are the gaps we have seen, and definitely there is a need to improve awareness and availability of these tools for the people who are looking for services or support, and definitely not every tool fits for everybody's need, so there needs customization, so in terms of the support and care available to all those with mental health needs.
Wonderful, thanks, Nancy. Michelle, or any other panelists, anything else you wanted to add to Nancy's response?
Yeah, just to say that, that is some of the work that there is to be done as well. I know in Nova Scotia, that's part of the reason that that we've engaged sort of a community coordinator who can have those conversations with people and get, build that comfort level with sort of why we're using tools and how they work, and how we know they work, and when they're appropriate to use. Yeah.
That's great. Awesome. Thank you. Very helpful. So, and Michelle, we have a question for you here. What is the difference between formal and informal care options that you had referenced?
Right. So for us anyway, when I'm talking about formal options, I'm talking about sort of through the health authorities, through the hospital kind of system. So those are usually, people who are exhibiting sort of moderate to higher needs, when they're going to sort of be, talking to a therapist or a clinician, that kind of thing, when we're talking about formal. But informal, things like just sort of reading information. Sometimes it's just, getting more information about a topic, or accessing some of our community partners that do work with sort of outreach work or drop-in centers or that kind of thing as well with folks. Or sometimes some of these e-mental health tools that are more in that mild to moderate space, that are self-directed, rather than sort of being engaged in, for us, the health authorities, sort of the hospital kind of system.
Great, thank you very much. Another question, and I think this could be for anyone. It's what about the healthcare providers, and how can we educate them on how to recommend certain e-mental health solutions?
I can speak to it, Simon. Definitely, specifically during pandemic, we see that even healthcare providers, they are looking for mental health resources and support. And also there are some trainings and courses available to healthcare providers so that they can help themselves or others who are in need of the mental health care. And so this is a time where these healthcare providers need the most support. And definitely there are opportunities for us to provide support and education to healthcare providers, how they can support themselves and others who are in need of the mental health.
Great.
I can add sort of part of how it looks for us too is having those kind of community of practice meetings and seminars and stuff too, and kind of accrediting them where we can, to get sort of clinicians and physicians and folks sort of to learn more about the tools and how to use them and when to recommend them. As well as sort of at that first, I know, so for Nova Scotia, we have a central intake line for the province. I know that it works differently in different provinces, but at that sort of intake point as well, training those people who are seeing people sort of calling in for the first time, or walking in for the first time, to give them the tools to be able to recommend those services to folks. as well as just kind of having that information available to the healthcare providers, whether they're out in the community, in private practices, or with the health system, to give them that ability to kind of have the information, have the data, have the background knowledge, and kind of get them comfortable with sort of knowing that the tools are safe and secure and have been vetted and are effective. All of those pieces.
Excellent, great, yeah, and such an important question, because we know from other research that Canadians trust their healthcare providers and want to hear about options from the healthcare providers. We know that many healthcare providers also don't necessarily feel like they've got all the tools at their fingertips to support their patients with mental health challenges. So it's such an important topic. Appreciate that. Another question, and this is for you, Michelle, is about the ability to reach the youth population. So folks under 18, do you have the ability to actually do that, and do you have the ability to track and figure out whether or not you're reaching folks in that age group?
So we do have some of that data. So through the website traffic analytics, the Google Analytics, we get some of that information about age. On our website, we also have, when people are sort of filtering through to get to what they are looking for, they get to filter by age if they like. So we can see sort of the number of people who are accessing that under 18, who are looking for either for themselves or others. You know, sometimes it's maybe parents or caregivers that are looking, or friends looking for somebody else. So we get all of that. It's also something that we look at when we're thinking about some of our distribution plans, some of our promotion. So we don't have any TikTok ads right now, but we do know that, you know, for example, the users of Facebook on average are older than users of Instagram. And so we get to see that age demographic and make sure that we're sort of capturing a wide variety of ages and along some of those different lines as well. So it is something we're looking at, and then we're also doing a more focused effort, a more focused sort of project to look at what we can do to increase, to make the site more youth friendly. I know Bridge the Gap has a great, they've approached it in a really great way to have those kind of two different sections of the site, whether you're youth or adults. So we're looking at kind of what we need to do to increase that sort of appeal to youth, and make that information sort of weed out some of the stuff they might not need to get to really what's useful for them.
Wonderful, thank you. And those are all the questions I have. So thanks for the great questions, folks. And I will now turn it back over to Nancy to wrap up.
Thank you, Simon. So I would like to thank you all the panelists for making this webinar possible and providing us the great insights. And I would like to thank you on the audience as well, who took the time to join today's webinar. As mentioned, the slides for this webinar will be posted on our website. Here is the link, and you will be notified when the slides have been posted. To follow our work, you can also subscribe to our Digital Health Info Watch newsletter using the link available, and enjoy the rest of the day. Thank you so much. We still have 10 minutes, and I will give it back to you to take some rest. Thank you so much, everyone.